Hi, my name's Mercedes Bern-Klug. I'm a professor of social work at the University of Iowa, and I want to thank you for taking some time to learn a little bit more about the profession of social work and the important role that social workers play with people diagnosed with dementia and their caregivers. So I'm going to share my screen, and I have a little PowerPoint. Thank you. I know that you're in the process of thinking about the data that have already been collected and data that might need to be collected. And I would like to make a pitch for considering data about the social workforce in terms of those caring for people with dementia and their family members. I come to this as a researcher, but also before I went back to school to get my PhD in social work, I was Alzheimer's support group leader for 12 years and was involved with support groups where we separated people with dementia from their family members and had special psychoeducation for the family members and then activities for the people with dementia. And I was also part of dementia support group for families only, and heard week after week, month after month, year after year of the challenges and the triumphs of family members caring for a loved one with dementia. And I recognize the important role that social workers can play as part of a team to really help support those family caregivers, because through thick and thin, it's going to be the family caregivers across the care transitions. And we have to make sure that we're having our services focused, of course, toward the person with dementia, but also that we are including services toward family members because they're the ones who are journeying with their loved one. All right. Many people don't realize the breadth of skills that social workers have, but we do have the skills and knowledge to support people with dementia and to support their families. I'm going to talk just a little bit about that. Social workers are the nation's #1 mental health providers. There are more clinical social workers providing mental health care than all other mental health professionals combined. And so, because dementia includes so much need for emotional care and mental health care, we want to make sure that we're including social workers in the dementia workforce. What are the areas of expertise for people with a social work background? Care planning, and it's care planning throughout their trajectory. As you know, the needs of the person with dementia and the needs of the caregivers change as the dementia progresses. And social workers are in the community, they're also in the clinic, they're in hospitals, they're in nursing homes. And so they're able to connect people with resources throughout the trajectory, and they can help prepare the family and the person with dementia for decisions that may be coming up in the near future or far future. Care transitions. This is a really stressful event for the person with dementia and for caregivers. And social workers are there to help with discharge and help with admission. Psychosocial support. There are so many interpersonal challenges that can arise when a person has dementia and when a family system is providing support for a person with dementia. The amount of grief and loss is, for some people, quite overwhelming. And social workers help with providing that guidance through the grief and loss process and can help normalize the intense feelings of grief and loss that both the person with dementia and the family can have. And then also work to keep the person with dementia included in the community for as long as possible. Social workers assist other health professionals in decision-making support. Social workers are trained in advocacy at the individual, organizational, and policy level. and connecting family to community resources is really important for resources for themselves as well as for their person with dementia. We also are the formal care providers in terms of mental health provision. And then when it comes to end of life support, where really the decision maker is the surrogate decision maker, the proxy decision maker, the family usually, um, there's a lot of need for emotional support of the family as the end of life approaches with people with dementia. Talking about that, I want to talk a little bit more. Most of my research has been in long-term care and in the nursing home setting. Half of nursing home residents in the United States have dementia. So nursing homes are settings of dementia, and increasingly so. And then half of the dementia deaths in the United States every year occur to a nursing home resident. So the nursing home setting is a setting where there is need for a lot of excellence and end of life care for persons with dementia and for their family members. I want to also mention that social workers in nursing homes provide support to the direct care workers, to the nurse aides, the nursing assistants who are at bedside day and night. The social workers in the facilities also provide support to them because it can be, they're dealing with grief and loss as well. This is a study. I did a nationally represented survey of nursing home social service directors, and I asked about a series of dementia training, or not dementia, but just training needs in general, all across the social work board. And the number one training need that they expressed, and this was close to 1,000 nursing home social service directors, a nationally representative study, was dementia. And even though they might have some exposure to dementia and some training, they're saying loud and clear that dementia tops their training needs. So anything that we can do to better prepare the nursing home social service workforce to work with people with dementia and their families is going to be really important. And they have reported that that's what they need. As important as social workers are in the long-term care system in our country, I wanted to share with you that looking through different government database sources, I found only one data element on nursing home social workers that's collected by the federal government. And that is a relatively new data source, and it's the number of hours worked. And these data come from payroll records. They ask about a qualified social worker, they ask about the number of hours from a contract social worker or other social worker. The qualified social worker is of particular interest to me because nursing homes are the only healthcare setting that receives federal funds where a person can be called a social worker without having earned a social work degree. And so your study could be instrumental in characterizing the National Nursing Home Social Work Force and what are the educational backgrounds of these folks, and maybe helping to develop different trainings for people with different backgrounds. If somebody is working in a nursing home as a social worker and they don't have a social work degree, they're still quite valuable, and we need to invest in them because it takes a special person to work in a nursing home. And I'd like to see the schools of social work provide more support to people in nursing homes who don't have a social work degree and help them get the skills and education they deserve to provide the important care, especially at the end of life care for people in nursing homes. So there's only one data element that's being collected, and that's the number of hours. But there's so much more we need to know about the nursing home workforce dealing with dementia. And your study could really make a really big difference with that. These are the dementia workforce study areas. We don't have any nationally represented data collected on a regular basis about social work in long-term related settings in any of these areas. It's a desert of data on social work services in dementia care. So again, we social workers provide dementia care throughout the illness trajectory. We provide support to people with dementia and their families, and we assist with care transitions across settings, which can be so stressful for everybody involved. And then social workers also connect people with community resources. To improve services and outcomes, we do need that basic data about the characteristics and needs of social workers, the social workers who are providing dementia care. So I want to thank you for hearing me out. And I want to thank you for considering the inclusion of data about social workers in your dementia workforce studies. I'm available at the University of Iowa. If you have any questions at all or would like to talk privately, please contact me. My direct work number is 319-335-1265. And I mean it. I'm really interested in this, and I want to be a resource to you if there's any way that I can help. Thanks.